Honourable members, I have given leave to the Honourable Member for Onchan, Mrs Edge, to put a question of an urgent nature, and we'll deal with that urgent question first. It has been circulated to Honourable Members. Honourable Member Miss Edge.
Thank you, Mr President. I'd like to ask the Minister for the Department of Health and Social Services if you will make a statement on the recent closure of the private patients' units and the subsequent resignation of consultants.
Call on the Minister for Health and Social Care, Mr Ashford.
Thank you very much, Mr President. On Monday of last week, I announced an overhaul of private medical services at Nobles Hospital, which will be based on refurbishing and redesigning the private patient unit area and administration to provide a modern, attractive and profitable range of private services for the Isle of Man. We are proposing to close the private patient unit and suspend private operations for a period starting in early 2019. At this point, honourable members, in answer to the first part of the question, I can categorically state nothing has yet closed. I wanted to give reasonable notice period of the potential closure so that patients and their doctors could make the appropriate alternative arrangements. Turning to the second part of the honourable member for Onchan's question, I would not normally discuss the employment matters of members of staff in Tynwald Court or elsewhere, but in this case somebody saw fit to leak a private email to the newspapers. Not the consultant themselves, I should add, who I am led to believe is not happy that a private email with a limited distribution from themselves was passed to the newspapers, and that consultant certainly gave no one permission to do so. So in this case, I will comment briefly. The hospital management is completely dedicated in their commitment to improve care for the people of the island, be that public care or private care. We do respect our clinicians who deliver fantastic services day in, day out. Change does have to come though, Mr President, and sometimes that change isn't for everyone. So at the same time, and I'm sure I have respect for those members of staff who decide that it's time to move on. I'm sure that as we progress with the necessary changes to provide a modern, fit-for-purpose, patient-centric service, not just at Nobles Hospital, but throughout our health and social care system, it will provide attractive to many professionals, and I expect that we will recruit an excellent replacement to fill the vacancy left by this single resignation. I would also like to take the opportunity to thank the individual concerned for the service that they have provided during their time in the current role. I would conclude by saying, Mr President, that change can be scary. That's the nature of it. But if we do not change and provide modern services that people want, require, and quite rightly should expect, then we are failing in our primary duty.
Supplementary question, Miss Edge.
Thank you, Mr President, and thank the Minister for that update. First of all, I'd just like to ask the Minister, with regards to the memorandum that he sent round to members, would it be possible to circulate the reports and that were discussed on that to members? If that's possible, I'd appreciate that. And then, obviously, I'm sure all of us have had a number of questions asked by the public. The concern is that the Minister stated that the private patient unit is occasionally used for overflow patients for purposes, and I just want reassurance from the Minister that we won't be seeing Manx patients on corridors during the winter when we can be hit by various viruses, etc. And you know, what is there going to be capacity for isolation of our patients? And also, in the interim, without knowing this, with regards to private patients, if they do need to be an inpatient within Nobles Hospital, what provision is there going to be for them from January 19?
Minister to reply.
Thank you, Mr President. First point first, I will look into the reports and see if they can be circulated. In relation to winter months, as I just said in my statement, Mr President, and as I said in my earlier interviews with the media, there is a bed management plan being put in place. That may well mean that due to the winter months, we may keep the private patients unit open until March, which is when the biggest pressure is between the Christmas and the March. In relation to Manx patients being on corridors, Mr President, I most certainly do not expect that to happen. That is scaremongering in the extreme for anyone to suggest that. That's not going to happen. And in relation to inpatients after January, Mr President, once the private patients unit does close, be that January or March, then inpatients will obviously be dealt with in terms of NHS.
Honourable Member for Ramsey, Dr Allinson.
Thank you, Mr. President. I do have fundamental problems with private medicine and see it as an undue distraction from the operational ethos of the NHS, but yet people do have a choice to get private care and clinicians have a choice to provide it. In the press release of the 8th of October, it clearly announced the temporary closure of the private patients unit and suspension of private medical services for at least a year. Can I ask the Minister why there seems to have been a lack of consultation with the consultants, many of whom felt they could no longer see any private patients and therefore have cancelled appointments to see them, and some have made alternative arrangements to see people outside Nobles?
Minister to reply.
Thank you, Mr. President. My understanding is several of the private consultants already use clinical space outside of Nobles anyway. In relation to the suspension of private services, it is literally the services of the PPU, so the private patients unit, and also therefore the theatre use, because the theatre obviously, if you're going into an operation, you need somewhere ward-wise to put them afterwards. It does not affect the clinical ability of the consultants to hold their clinics. It does not affect their ability to be able to order blood tests, radiology, x-ray. That remains exactly the same. Those parts of the hospital will remain operational and will still be open for private practice.
Supplementary, Dr. Allinson.
Thank you, Mr. President. Could I ask the Minister, and I'd like to thank him for his reply, would it be possible for private consultants who already have people booked for private operations after the 1st of January to use some of the NHS facilities whilst they're not in use, perhaps during weekends, to actually fulfil their obligation to those patients? Thank you.
Minister.
Thank you, Mr. President. It is something we can obviously look at. I don't know what the position would be with that at the moment. But one thing I would say, Mr. President, is the Honourable Member for Ramsey did mention at the start about consultation with the consultants. The department has gone to the consultants and asked for them to come up with alternative proposals if they have any. As far as I'm aware, none have come forward so far.
Honourable Member for Onken, Mr. Callister.
Thank you, Mr. President. Can I thank the Minister for his statement? Could I also ask the Minister just to provide a breakdown of the £200,000 that was mentioned in the recent press release? Thank you.
Minister.
Yes, thank you, Mr. President. I most certainly can give a breakdown of the 200,000. In terms of the cash saving, the majority of it comes from filling agency staff from redeployment into vacant roles at Nobles. So, for instance, there is 329,000 potentially from that. There's also 232,000 from agency and bank staff from theatre, filling vacant roles. There's consumables saved roughly of 73,000. And then when you take the less forecast income level off, that leaves you with a total saving over the period of 203,000. One thing I should point out, though, Mr. President, is this has got nothing to do with the savings. We're not doing this to try and generate savings. We are doing this to get a modern, fit-for-purpose private patient offering. Over the last few days, I've been contacted by numerous individuals, some of whom think I'm crazy, I'll be honest, some that aren't supportive, but an awful lot that are. And perhaps, depending upon the supplementaries that come later on, I might be able to share some of those quotes, Mr. President.
Honourable Member for Ramsey, Mr. Hooper.
Thank you, Mr. President. My question concerns consultation and the alternatives that the Minister said may or may not be forthcoming from consultants. In the briefing note that was shared to members, the Minister advised that medical staff representatives were briefed on the 26th of September, and then the public announcement was then made on the 8th of October, so that's a period of 12 days. Was that the timescale for alternative proposals, or will alternative proposals be brought forward any time until the closure is actually finalised?
Minister.
Thank you, Mr. President. Happy to clarify that. We're happy for alternative proposals to come forward at any point in time up until the closure. That is the exact reason we've deliberately given 3 months' notice, because consultants obviously have lists already programmed in, which we need to deal with. We needed to get the general public informed, but equally we had to inform the staff. And obviously it is a disconcerting time for staff. I'm not going to shy away from that. It is when you change anything. But one of the important things is that we engage with them and we find them appropriate roles within Nobles. So one of the things that I have been very keen on, Mr. President, and I've made absolutely clear to my senior management team, is they should be equivalent roles to what they have now, and they should also, wherever possible, try and fit the same shift patterns, because we also recognise that our employees do have a life outside of the hospital.
Honourable Member for Douglas North, Mr. Peake.
Thank you, Mr. President, and I welcome the Minister's positive statement, and I did serve as Member for Health, and I was very proud to do that. And I know at the time there was a lot of interest from third parties. I'd just like to ask the Minister, has he been approached by third parties to offer these private medical services in the recent times?
Minister to reply.
Thank you, Mr. President. As part of my original announcement, I did say we'd be looking to partner with third-party providers potentially. I can actually state here in this honourable court that one provider proactively off their own bat has contacted the department to say that they may be interested, and I have also now received communication from a hospital in the UK that has suggested they may be willing to help offer private services to island residents during the closure. So it is positive, people are coming forward, and there is third-party organisations that have been energised by the announcement.
Honourable Member Miss Edge.
Thank you, Mr. President. The Minister's just talked about the possible savings and the staffing. He didn't talk about staffing numbers. Could he confirm or circulate to members how many are permanent employees that he's talking about and how many were agency? And also, obviously, there's been a full business case prepared for this. Is that possible to be circulated to members?
Minister to reply.
Thank you, Mr. President. I can confirm in relation to the staff, the equivalent of posts within the private patients unit is 19.55, and that at the current time, there are agency staff which are backfilling ward vacancies of around about of 9. So that's the HR figures I can give. And I think the Honourable Member asked me about the circulation of papers. As I said, we will look into that.
Honourable Member for Douglas South, Mrs Beecroft.
Thank you, Mr. President. Whilst welcoming the news that the private patient unit is going to be refurbished, because there's no doubt it definitely needs to be, I wonder if the Minister could give some more information on the cost and the time frame, because it was supposedly 18 months for 300 and something thousand. It just seems an awful long time for that refurbishment. You know, when you think that Promenade is 25 million for 2 years, when you compare the two, it just something seems to be a little bit out of kilter. So I wonder if you could just give a bit more information on that.
Mr Ashford.
Thank you, Mr. President. In terms of the costs, the indicative costs at the moment are roughly around about £300,000, and also, off the top of my head, Mr. President, I think it's about £60,000 for the necessary admin and IT systems that would be required. In relation to the 12 to 18 months, as I made clear in my press interviews around this, that is a maximum period. Obviously, we would be looking to do it quicker, but one of the things I must say with the private patients unit is it would be a complete redesign. So we would need to look at the way the unit is laid out, the way the individual rooms are laid out. It's not just a case of slap a paint job and open the doors and done, but obviously if it can be done quicker than that period, we would look to do so.
Honourable Member for Ayr and Michael, Mr Baker.
Thank you, Mr. President. I welcome the positive approach by the Health Minister in trying to reshape the health service fit for the 21st century, and inevitably to make changes is going to be some disruption. Can I just ask two specific questions, Minister? Firstly, what do you expect the impact to be on general waiting lists as a result of this action? And secondly, what's the process that the department is going to go through to potentially attract a third-party operator? Because clearly parties come into the department and express an interest is one thing, but clearly something like this, which is of major significance, needs to be a proper structured process followed over the coming months.
Minister.
Thank you, Mr. President. I can confirm, I'll do the last one first, in relation to expressions of interest. Obviously, there is a set process we have to follow. It's not just a case of someone comes in, says, oh, we're interested in this, and we go, off you go. We have to go out for proper expressions of interest, and we will be doing so towards the end of this month. In relation to the impact on general waiting lists, obviously, as I say, what is ceasing is the use of the private patients unit and by virtue of the theatre. So it's not all private practice that is ceasing. So in relation to that, there's going to be more time available, obviously, for NHS. So actually, the prediction at the moment is that waiting lists will either remain as they are or a slight decline.
Honourable Member for Council, Ms Lord Brennan.
Thank you, Mr. President. Some private services are not available on the NHS, and some private services will require the use of a theatre. In some cases, to do with dentistry, for example, if the services are not being carried out, then there may be a case that the person ends up going out to another service that's not within the hospital environment and perhaps is not the right sort of service. Then they may end up coming back to the NHS to try and get the problem properly sorted out. So my question is, as all private services are not really definitely linked to the ward, can you look at those services, separately, the private services that aren't otherwise available on the NHS and that aren't so dependent on the ward?
Reply, sir.
Thank you, Mr. President. I'm happy to answer the Member for Council's question there. In relation to that is something the management team is already looking at in terms of theatre time. Obviously, the use of theatre linked to the private patients ward, where people need to be inpatients, is different to those potentially who are outpatients. So that is something already being looked at as part of the plan.
Mr. Speaker.
Thank you, Mr. President. Can I just ask the Minister to what extent, if any, patient safety was either a trigger or a consideration in this decision?
Thank you, Mr. President. I can categorically confirm that, obviously, while patient safety is considered in every decision that the department takes, the main driver of this decision has, from day one, been to ensure that we get a proper private patients offering. I will take the opportunity, since Mr. Speaker's raised it, Mr. President, just to raise a couple of comments I've had from members of the public who've actually used the service in the past, which is one of the reasons why we are driving this forward. One comment I've received was, what you have now isn't a private patients unit, it's just another ward of Nobles, an NHS ward you pay through the nose for. As a service user, I welcome the changes. It's time we had something fit for 2018, not 1980. And a bit more of a colourful one from someone who wrote to me to say, as someone who has used the service and has also had cause to use private patient facilities in the UK, I did not feel I got any value for money. In fact, I would say it was daylight robbery. At least Dick Turpin had the grace to wear a mask. So those sort of comments and those opinions are the primary driver behind this.
Honourable Member for Onchan, Mr. Callister.
Thank you, Mr. President. Can I ask the Minister if he's confident that we will actually have a fit-for-purpose private health patient unit in 18 months? Can I also ask the Minister why the private patient unit is actually costing the taxpayer £200,000?
Reply, sir.
Thank you, Mr. President. I didn't actually say the private patients unit was costing the taxpayer £200,000. In terms of the saving, that's from backfilling vacant posts that we would otherwise be filling agency with in the NHS. So that doesn't translate to say that the private patients unit is costing us £200,000. In relation to, am I confident that we will have a modern, up-to-date private patients unit? Yes, I am. Very much so. One of the things I've made absolutely clear from the day this announcement was made is that personally as Minister, and I know my department members as well, are 100% committed to ensuring that we have a proper fit-for-purpose private practice on this island. That is what is the driver of this decision. I have heard nonsense going around that, oh, this will be the end of private patients, it will finish and it will just never restart. I can categorically say to this honourable court right here, right now, that is not true. I am as committed to anyone to ensuring that the private patient offering is up and running and that we have something that is the envy of all the jurisdictions.
Okay, one last supplementary. Mr. Hooper.
Thank you, Mr. President. I think it was in his newspaper interview, the Minister commented that there'd been a blurring of the lines between NHS and private practice on the Isle of Man, provided out of Nobles. I just wonder if, as part of this review and disclosure, will he be addressing potentially inappropriate use of NHS resources by private consultants, for example, the issuing of NHS prescriptions out of private clinics, and other obviously more serious items. I just wonder if you'd comment on that briefly.
Minister.
Thank you, Mr. President. It most certainly will be addressed, because as we bring in admin systems that are completely and utterly separate from the main hospital and are purely for private, in some ways it will correct itself. One thing I do want to make absolutely clear, though, is in relation to the blurring of lines between NHS and private, what I was referring to in that newspaper article was the use of the private patients unit. So, for instance, at the moment, it is not a dedicated private patients unit. There is the overlap, as several members have already alluded to, where it is basically the staff are moved to various things. It's not a proper private patient offering, and that is one of the biggest gripes I get from the users of the service. So that's what I was actually referring to in blurring a lines, but in answer to his other question, having completely separate, accountable, transparent admin systems, which personally I don't believe are currently in place at the moment, will ensure that that is stopped.